public sector and budget implications talking series, and this will be led by both Edith Yembra and Lisa Hunt. But before we get into the nitty-gritty, we just have some housekeeping rules. So if you could please make sure that your microphone is muted while we're in the midst of the discussion. If you do have any questions, please do drop them in the chat, but if it's pressing, you can raise your hands and Edith or Lisa will answer your questions. And then finally, if you can please connect with both myself, the public sector LinkedIn group, and Edith and Lisa, that will be fantastic. So I will hand over to Edith and Lisa, and I hope you enjoy the session.
Thank you, Petra. Good afternoon, everyone, and welcome to the Budget Implication and Increased National Insurance Contribution on Public and Not-for-Sector organizations. We are actually going to focus on this session and explore the impact of the budget implication and national insurance contribution on smaller charities, and basically tell you from our perspective, our organization, what is going on and what has happened and how we intend to leverage stuff. I know Petra introduced me earlier. My name is Edith Yembra, and I'm the chair of the public sector panel. And I have got with me Lisa Hunt, who is the CEO of my organization. And so you are free to make the session as interactive as possible, and do also drop your questions on the chat, and we will try as much as possible to answer your questions. And everybody is aware that at the last budget setting, the government introduced the increase in national minimum wage, and then increased in national insurance contributions, which became twofold. The increase was to increase the national insurance contribution that employer pays from 13.8% to 15%. Additionally, they also reduced the level at which employer pay national insurance from 9,000 to 5,000. And so the increase was double, so to speak. And that has caused a lot of financial challenges for smaller charities. And so we're coming to you today to tell you what we as an auspice and a charity is actually facing, and what we are doing in terms of mitigating the risk that the government budget has costs. So I would hand you now over to Lisa to elaborate on the challenges that we're facing.
I think one of the interesting things for us as a charity, we are very much a healthcare provider, but we are always funded through a grant. And for hospices, that grant can be as small as 15% of its total running costs covered by the NHS, or possibly the maximum 30%. And historically, our funding has come from A, the NHS, B, our retail arm. As you know, lots of us as charities rely on our retail sector and income generation. And I think Edith and I recognise that we've just hit a perfect storm within our charity. So all three of those income funding sources have been impacted on, although maybe marginally, they have a massive impact on the back of.
Yes, I'm not sure more meetings can happen. So.
Oh. Okay, didn't know if that was a question. So not only have we got an impact on all three funding streams for us, you know, the impact of the national minimum wage, the national insurance, along with just our day-to-day bills going up in a substantial way have been very, very challenging for us. However, because a lot of our services or our core services are providing clinical care, we still have to remain competitive in that market. In order to survive, we need to be able to match things such as the NHS salary. And that is something that we've had to knowingly increase our costs going in to this year's budget. Hospices are struggling, and that's our charity, around the whole country. And when we're looking at solutions, how do we overcome this? And you will perhaps have seen in the national press, lots of hospices coming together as a merger. The issue for me, and I think the issue for Edith, is two challenged hospices doesn't make a viable company going forward. So we are very much stripping back, understanding our cost and our income. We feel it's within our gift to do things differently, and that's what we will now start to share with you. Do you want to go first? Or?
Mm-hmm.
So we've introduced, we'll do this jointly. Edith will just let me know when I'm over talking. I feel really strongly. So my history has been sort of chief exec within the NHS sector. And, you know, value for money, Edith is constantly reminding me about value for money. And one of the things that we've brought into the hospice, which has been really new, is measuring our productivity. When I first started looking at productivity of our clinical services and how much contact time was being made with our clinicians, shamelessly, I'm telling you, it was only 26%. So we started to look at the way that we manage those services, the way that we run those services, and we set a productivity target of 74% of all time for clinical staff out there in the community looking after our patients. 74% of their time need to be clinical facing. What that enabled us to do was last year we increased the number of patients we'd seen by 200% without a single additional penny spent. So productivity, having that productivity as a golden thread through everything that we've done, has certainly helped us eliminate waste or maximize value for money. As I say, something Edith is constantly challenging us with. You want to?
Yeah. And we've also introduced elimination of waste. By this, we've actually include all the budget holders into a budget meeting, cost improvement plan. The cost improvement plan means you come in there and we say, now that we're not going to have as much income as we think we're supposed to have, what are you prepared to cost? Come in with your cost improvement plan based on 3% of your budget. And that is what we're doing. So there is no like nice to have in the budget. Rather, we need what needs to be have. It's better you come in with what you say I need rather than what I want. And as a result, we've been eliminating things, and people have actually buy into that to say, oh, yes, I did have this in the budget, but no, I don't need that. Oh, yes, so I can do without that. Yes, I can do without that. And so we're trying to tighten our budget to make sure that we end the financial year, even if we break even or a small surplus, but rather than a deficit, because we have to show that we are, in this together, and we want the organization to be, as Lisa said earlier, to be competitive in what it delivers in terms of our services to our patients. And so, again, looking at this, we started looking at contracts where we are sure that we can make an impact on, because most contracts, if you don't go to tender, they just auto renew itself year on year on year on year. And as a result, if you don't look at those things, then the increases which you carry year on year. But going to contract means, going to tender means that people would then think about it. And because now you're looking at value for money, you're thinking, what am I paying for? Am I getting value for money, and how much of value for money am I getting? Can I get it cheaper but with same level of service? And so we've done that in a few of the things we've done. We've done it in terms of audit. We've done it in terms of insurance. We've done it in terms of maintenance contract. And we can see that we're beginning to realize value for money for some of these things, which naturally you wouldn't be looking at because you think you're used to just paying for what you get year on year without evaluating what you're getting money for.
I'd like to pick up on, I suppose, as the chief exec, what I've been working on, or the most important thing for me, is reducing the run rate for very, very obvious reasons. We need to be able to live within our means. And as long as I understand what's feeding into that run rate, then I can start, and more collectively, the executive team can start asking the right questions. But at this point, I think the biggest thing for me to make this successful or not is how we do this, how we eliminate costs, how we get more value for our money, how we get more contacts through productivity and bring our staff with us. And for me, it's a cultural piece. And how do we get the people at the very shop floor who are caring for our patients to understand what Edith and I are driving here? And we've launched this campaign, marketing campaign, if you like, and it's delightful how our staff are engaging in this. Our strategy is every person matters. That drives our whole clinical strategy, the organisational strategy. But underneath this financial year, we have launched an every penny matters, every contact counts. And the staff have engaged in that one. And in fact, I went to the staff forum the very last month, and as we are and we've probably cut out in the last couple of weeks, in all honesty, about 750,000 in our future cash flow forecast because it wasn't affordable, our run rate wasn't affordable. How can I actually do that and not make staff felt done to? So we made it part of the importance of when we receive charitable giving, when someone has climbed the 3 peaks and brought in 2,500, we've translated that back to, it cost us £2,500 for overrunning of our electricity and our air conditioning in parts of the building that have been empty. So we're trying to bring our staff along with us. And what I've found is they themselves can see waste in a way that we can't. And so we now have a digital innovation box linked to our website every single day where people have bright ideas of their contributions. Now, I know this is a bit of detail, but it's getting the staff cultural shift. I had a cleaner knock on my door last week who said, "You do realise, Lisa, that the hand soaps that are on the sinks cost £50 a week to replenish." And she asked the question, why are we doing that when we've got the normal cleaning, high infection control soaps on the wall? She made the decision to remove those soaps. She saved me £50 a week. I was so delighted that she's actually owning this. She came back a couple of hours later and said, I can cut the costs of the hand towels, Lisa. I've found a different version. This is a domestic, someone who's engaging in what we're trying to do. So that feels it's grabbed momentum, and our staff aren't fighting us on this. And it's making it a very less painful experience, I think, for all of us, because in real terms, we're slashing the budget. Let's be honest, in order to bring down our run rate.
Yeah. And again, part of the reason that smaller charity like us are also facing financial challenges because of the budget is, as I mentioned earlier, is the increase in national minimum wage.
Yeah.
The increase last year and then the increase again 2 financial years ago. I think it was just enormous. The percentage was just so high. And as a result, the moment you take on that increase and say, yes, those on national minimum wage, increase them, straight away you have to increase your team leaders, those that are on top of them. And so you're not just increasing those that are on the national minimum wage, you're increasing those that they are reporting into. Otherwise, there's no difference between their salaries. So that has become a real problem for us. So it's not just those on minimum wage, but those that's on the next level after them. Again, that is the increase. And the fact that the budget also reduces the level from which you begin to pay national insurance, which was previously 9,000 and now is 5,000. It's a lot of money for the organization, for smaller charities like us to bear. Additionally, moving from 13.8% to 15% is massive. It's massive for smaller organization like us, most especially where there is no grants coming from the NHS to cover that. So again, it's a difficult one for us. So what we're doing as part of mitigating those actions, and another actions that we've taken is to reduce our standalone software. And sometimes you come into an organization and you have 4 or 5 different softwares, and all of those software don't integrate with one another. They all stand alone. No one talks to the other. But then it's going to be costly to try and relook at the infrastructure of that and to continue to service that which is required. So as a result, we went out to tender and got a new managed service provider. And in that tender document, we were quite smart in adding GDPR as part of what the managed service provider will be providing. And so they then provide training on GDPR, and the staff are quite happy with that. So what they do is they give you every month 10 minutes of GDPR questions to ask you, what do you understand about phishing? And they show you a video and you listen and you follow, and then you answer those questions based on the answers that they're getting back. Sometimes they can reintroduce a different question or reintroduce the same question in a different way. So we're doing all of those things to try and reduce the challenges. But the challenges, as Lisa was alluding to earlier, the staff are on board with us, so we have their buy-in, and then it makes it very easy for us to do.
For me, as the chief exec working alongside Edith, at a certain point, I'll be honest, it felt like it was our problem. And so the first thing we needed to do was shift to make sure that all our operational leadership team equally owned the problem. And my challenge to all of my team is be curious. It's an interesting one, running a hospice, because it's a charity, and there's lots of legacies I found, that things get, well, we've always done it that way. So I think by the executive team, we look at the run rate every day. We look at our forecast cash spend every day, and we ask curious questions of each other, and we allow all of that. What that's meant is that we start then to look at others through benchmarking. Because for me, I am running a clinical service and I need to know that while I'm taking costs out and I'm driving up efficiency and productivity, I'm not damaging the quality of the service. And so what the benchmarking has shown, particularly in a clinical area, that actually there was opportunity to change our skill mix. There was opportunity by using a different rostering system to get more efficiencies. And we've actually changed the number of staff working per shift. And that's not about reducing our quality, it's about understanding through benchmarking what is actually required, not based on historical trends that probably have gone back to 1980. So please encourage staff to be curious, to be open, honest and transparent, and allow other people from other areas to start asking questions. You'll be surprised what nuggets you can find. We have probably taken 20 staff out of this organisation in the last few months, all of which is helping with the impact of those increased staffing levels to remain competitive within the NHS environment, and all of those wage increases that we've seen come through, and we've got no added value for that on reduced income. But that's, if you like, the command and control approach. But there are other more innovative things that we will go on to discuss with you, and the way that we're looking at funding our charity. Is that the next slide?
Yes. Again, in terms of all of these things that we're doing, we're now looking forward. So what are we doing in terms of looking forward? We're looking at diversifying services and attracting extra income. So we diversify our incoming streams to reach out to more people. It's not as if we're not reaching out to a lot of people before, but we are reaching out to more people now, because the cost of living increases have meant that donors who would normally give money are now not being able to give money because there's cost of living, and things are so expensive. And so donors have actually cut back on what they were in giving us money. And again, we're also using some of our reserves, because trust and foundations, when you write donor applications to them, they want to see what you hold in terms of your operating policy reserves. They want to know how much money you hold in terms of your reserves. And if you hold more than 3 months, then they're not ready to fund you. So as a result, things have become really difficult. And that is why we started saying, okay, if we can control the income, we can control expenditure. So the income will come in to an extent, but what we can do is tell when people are going to give us income, when are they giving us income, and make them give us income. That you cannot control, but at least we can control our expenditure, which is the reason we're doing what we're doing, to make sure that the income that we have and the expenditure is we're sustainable, because we have to be financially sustainable for the future to come. And again, we also have Hospice UK, who we are affiliated to as an hospice, and they are also helping to see what they can do to help the smaller charities, the hospices like us, with some financial grants, but they are linking those grants to capital expenditure. And so that has been a help for us. So whatever your organization is doing, or whoever you're affiliated with, they will have some kind of help that they can give. And so sometimes if you don't have these challenges, you probably don't look further afield. But the challenges has meant that we're all pulling together to strengthen our financial planning, our risk management, to make sure that we are actually reviewing and optimizing operational costs, and communicating the impact of whatever we're going through with our donors, with our funders, and our beneficiaries. Lisa, you want to take it up?
So for me, coming in and looking at our strategy and understanding who we are, what we are, was really important. Lots of people see a hospice and still use a hospice as somewhere where they think people come to die. We're changing that perception at Garden House. So we won 3 national awards last year for looking at what we do and looking at whether or not we can provide through a different lens. And I'm going to be honest with you, it's a case of data, data, data. So I looked at our local community and I looked at anybody who has a life-limiting condition, and I found there are 5,000 people in our local community. Why then was I only treating around 2,000 patients a year? So there was a need in the community. But those 3,000, 5,000 aren't at the end of life, but they've been told their condition is incurable. That makes them frail. Hang on a minute. Isn't there a whole national drive on reducing pressures in A&E, dealing with frailty at the NHS level? What we were able to do, we piloted it first, was prove that we can be successful in a different way by treating different patients to our normal, and it attracted last year an extra 766,000. And that kind of changed our destiny. We were heading for a negative deficit budget and we ended up breaking even. That is a long-term plan. We've been disrupted this year because of all the budget pressures and because of the changes in the NHS. But what I would advise you to do is say, where is the money? Where is the route to that money? And how and could and should you diversify to attract the money? So that's very much something which within Garden House we're now doing. In fact, over the next 12 months, we are getting rid of the word hospice because it limits us from being able to treat people who are not acutely unwell, but on a long-term conditions. That opens up our sphere and it opens up our funding model, and it feeds to a 10-year strategy that makes us viable. What Edith and I understand we have to do is shift from a 30% secure contracted income to 70%. And as soon as we're able to do that, then we become more viable. What's interesting for me is I can now start to look for tenders, look for contracts, look for other areas, and I will also be able to undercut them because I'm only looking for 70% funding. Because the one thing I can be sure of is that my income generation team can pick up 30% of the funding. What they can't do at the moment is pick up the 70% of the funding. So this is a strategic shift for us over the next 10 years. The other thing we've done, and I'll let Edith talk about this as well, because Edith has a different lens to this, but we've consciously separated the trading company. The trading company now being a standalone subsidiary company that allows us to generate shamelessly as much profit as we need to fund the charity. So I'm currently looking at whether or not I can buy a nursing home, not something I'd do under the hospice remit, a domiciliary service that I can get a £3 million profit from. And that in itself helps me become a more sustainable charity. But I'll let Edith talk to you more about that.
Okay, so we are a small charity. On the other hand, we own a small trading company. So what we decided to do in order to be able to do all of these things that Lisa's just mentioned, because as a charity, you cannot be making a profit. And there's a limit to the kind of services that you can do and run. So as a result, to be able to do most of those things, we then actually separated our trading subsidiary. The trading subsidiary was set up by the charity, and then the trading subsidiary then trades in retail shops, charity shops, and then also at the end of the financial year, donate all its trading profits to the charity in order for it not to pay corporation tax. So in order for us to grow and diversify our income and resources and be able to get those big projects, which we cannot do under a charity because it's not part of our charitable objectives, is to separate the trading company completely legally. So what we've done, we've moved all the trading staff that works solely in the trading company into the trading away from the charity, and that also mitigates the risk of those staff from the charity, so that they're now in the trading company. So everything that we can't do as a charity because of our charitable objective, we are now doing through the trading company. So the trading company is now going to trade just beyond charitable shops and do the big profit, big trading, and then deliver the profits to us at the end of each financial year and make us financially viable. So between the trading company and the charity, once these things work well for us, as it is at the moment, we're going to expand and increase our profit margin and be sustainable in the long run, because the charity needs the trading company to work and donate its profit to the charity, and then and then we can be sustainable and be here for the foreseeable future, for the patients who need us, and extend our services. Again, the charity commissioner did say that although you're a charity, yes, but you must have a commercial mindset, because you have to run it like a business. You cannot say because you're a charity, you don't make a profit, you're only going to make a surplus. As a result, keep taking in the cost and not looking at the income, not looking at the cost. No, the mindset have to change to say, if we want to be sustainable for the foreseeable future, we have to change things. We have to change the way we do things. We have to be financially viable, and we have to be sustainable going forward. And that is the mindset of the commercial people, and that is what we're doing at the moment. So the time of saying, oh, we're a charity, therefore we can't do this, or we're not going to do that, those times are gone. Otherwise, we will not be here in the foreseeable future. So having that commercial mindset, it does help as well. And luckily, as Lisa alluded to earlier, we've got buy-in from our staff and the senior management team as well. So we're all moving forward in the same direction.
Don't get me wrong, getting that mindset, I think, was quite challenging. Yeah. But very early days, Edith was always, I think it's the repeating the value for money. What is the return of investment? Making sure that our processes are robust. One of the things for me, for you just to be thinking about, is what is your risk appetite? Because we are, as charities, we're very vulnerable. And I think for us, we understand that doing nothing isn't an option, because that is a sure way of a certain fate, I think, for lots of charities, and certainly for us as a hospice. And so there is a conversation that I had to have with our board. Many of us are relying on our reserves. Many of us, particularly with the pressures that we started the presentation with, are challenging our reserves. And so very much for us, it's cost containment. This is for us a year of consolidation But we've also, I need you to be, you know, we are very much driven by the data. That's the only way we can be commercial. And we've had to invest in back office to make sure that we have that data, particularly if I'm tendering against the best for some of these services, then having that commercial mindset, having that data in order to be able to evidence is important. But what is our risk appetite? So as I said to you earlier, we went at risk. 300,000 we invested in a particular quarter to say, when we first started up the frailty, this is what we're going to do, and we will evidence it's going to save 2.5 million to the NHS. We didn't ask for a penny, and we did it at winter when there's normally enormous pressures, and that's what made us successful. And we actually were able to evidence what we could do. And out of that 5-year funding of just around £4 million. So that provided us sustainability. But the problem is, for us as a charity, we have to work on cash. And I think that's the most challenging thing for us. So, you know, it's about making sure that money comes in. But it's knowing together as a board, are you prepared to take a risk? Because just cutting and containing isn't actually going to save this hospice, but being able to invest to grow is our current strategy going forward. I'm aware we've not taken any questions yet.
No. So what I'm going to do now is facilitate an open discussion, encouraging attendees today to share their experiences, their challenges, and successful mitigating strategies. You know, the key point for us to discuss today is, what are the most significant financial challenges that your organization is currently facing, and how the budget changes and the NI contribution affecting your financial planning, and what strategies have you found to be most effective in mitigating this impact, and what are the lessons learned and best practice that you will want to share with others. So please, you can have a raise hand or unmute yourself, and let's, address these questions, and then, and share your experiences. Yeah, go ahead.
Hi, sorry, if you can see me. Thank you so much. Sorry, my voice is a bit crackly, but thank you so much. I know, Edith and Lisa, that was so insightful, and I think it was quite encouraging, because I could deduce quite a few things that we are also looking to adopt in our charity. I work for a religious charity, and so there were quite a few similar things, things that we've been largely impacted as well by the increase in national insurance, because we've got quite a strong staff base in terms of numbers, and we've seen donations, because prior to COVID, and I think even post-COVID, we were largely funded by donations, mostly from individuals. And as they have been impacted, as their business have been impacted, it means that the donations have started to shrink. And so we've had to rethink and stretch our minds in terms of diversifying our income streams. And so we've also had to put on a commercial hat. They've got a building that we're leasing at the moment, so we're trying to rent out the space just to generate additional income and see what else we can potentially do to leverage the building, because for most parts of the week it's empty when things are not necessarily happening and the staff are largely working remotely, and so it's hard to do that. We're also looking at where we can collaborate with other charities who share similar objectives. So we've got our standard objectives, but I think prior to now, there was always that mindset, or we had to try and achieve it alone. But now we don't want to get lost in that. It's not about, we're not competing with any charity. At the end of the day, what we want is for that service to be delivered to the beneficiaries. However we get it there should not be a case of we have to be the ones to do it. And so we're trying to see how we can collaborate more efficiently. Also leveraging grants more, obviously organizational grants, but also trying to get into spaces where our members work, and see if we can get a cut from CSR allocations in organizations by really showcasing the strength of what we do, all of our community initiatives. So we found that we have a trading subsidiary already, so that looks at different trading activities like a cafe, a bookshop, and transfers its profit so that, yes, under gift aid, so that we don't have to pay COP tax, like you rightly alluded to, Edith. And so that's one of the things that we've been looking at. We've also tried to, I guess, relook at our mode of taking on staff. So as opposed to just taking on people under PAYE, we're looking more at maybe short-term contract routes so that those added costs of engagement are potentially not there. And if it's a short-term project as well, as opposed to bringing someone on staff and paying the added employers in, sometimes there's the added cost of training and all of this holiday cost. We're then looking at whether or not we can just bring in, and in some cases, it's really worked out cheaper, just getting short-term contracts in that sense. But I think I also have a question, because I could deduce a few things that we're doing. But I was listening to Lisa, Chief Exec, and I thought, wow, I was really inspired by the buy-in from the top, because I think that potentially might be an area that we are struggling with. And sometimes, so when I look at the cost cutting, the containment, just trying to be a bit more cost effective. I don't know if anyone has that challenge, but sometimes being a small charity, maybe also being religious, you're dealing with founder syndrome, and you just have that, oh, this is what we want to do, just find a way to make it happen, and you're struggling to balance it all. So it'd be great to hear from anyone that, I don't know, how do you, without coming across like you're constantly, just going against what is being driven from the top, how do you really influence effectively so that at the end of the day, we're all going in the same direction, trying to achieve the same purpose without compromising on our key objectives, in a sense?
I suppose what I'd advise you to do, even if you haven't already, ultimately, as the chief exec, I'm accountable for the organisation. It's not Edith. All Edith can do is paint the picture for me and show me the pitfalls that are arriving. And it's interesting what you say, because when I came along, in fact, Edith and I kind of arrived not far apart. And even though we have trustees here, a lot of them have been here forever. It's a very interesting relationship we have with them, because they don't want to hear any of the bad news, do they? I mean, what they would do, and I'm being really honest with you, they just asked Edith to come back with a different report, cut a different way, because I think what they were hoping is that actually it's something that we can, as magicians, by changing the way we're reporting, make the problem go away. And I think, you need to be as open, honest, and direct as possible, because ultimately, as founders or as chief exec or as trustees, they own the problem. And I think one of the things we did to make the board own the problem is we put a new risk register. It doesn't sound dynamic, but trust me, when they own the board assurance framework around the sustainability of the organisation, that they have to sign off every month to put scrutiny on us as the operational team, that we're doing everything in our power to maintain viability, sustainability and safety. Suddenly they bought into the process and they started to own the risks with us. But you do need your chief exec owning the problem. I think that's one of the biggest things for us, isn't it? And to be honest with you, it can't just be the chief exec either. It needs to be every operational manager needs to own this.
That's right. That is right. Petra, do you have any more questions on the chat?
We have a few. So the first one is from Dora. Can I ask about the separation of trading subsidiaries? Did this result in additional administration burden on the organisation?
No, it did not. because the staff were already there. We have this trading company, we have the charity. They're already working solely for the charity. And so what we did in terms of doing the separation to make our trading more viable is I contacted the solicitors and I said, this is the way we're going. And she said to me, oh, when do you want this to become effective? I said, 1st of April, but this was in January. And she said to me, oh, because they're already your staff, there is no need for a TUP. It's a light touch consultation. And so we spoke to the staff, let them know what we're doing, let them know what's going on. And it wasn't a problem. It wasn't an extra burden or administrative cost. It was just the only thing we had was consulting the solicitors and say, this is what we want to do. And they said, no, it's a light touch consultation. So it went as smoothly as possible.
And then from Glenn, your circumstances and income types are very similar to ourselves in the third sector. Our reserves have been impacted over the past decade to mitigate deficits and support essential programs where we find it strangely difficult to fund. This depletion of reserves cannot continue, and funders should not overanalyze this, but they do. Is this something you are also struggling to maintain healthy reserves to remain being a going concern?
Well, it is because we have also used some of our reserves in order to reduce the level of reserves and so to be competitive, to be able to put in more trust and donation grant application, because those are the people that were rejecting application for funding to say, you have enough in your reserve, spend down your reserve a bit. So we've done that. So now we can go back and say, look, we have now spent down our reserves, which was one of the reasons where we're not getting funding. And now we're coming back to bid for grant. But at the end of the day, it's also depends on what else we're doing, which is why we're using the separation of the trading company to look for more businesses, which we can do as a charity. But at the end of the day, we have to make sure that we have at least 3 months of our reserves to be sustainable going forward. And the people, the trust and foundation, also, when you sometimes put in application, all they want to do is give you restricted funds. And so they restrict it to particular projects. And we've also been caught up in that, where they give you money and they say, this money is for this particular project. And once it's restricted, you have to spend it based on the criteria with which you got the grant. And whatever is left unspent would then automatically get carried forward until you finish it on what you said you were going to use that money for. So the way they do it now is tie that money into projects rather than give you unrestricted or designated funds. So yeah, so we're actually experiencing the same issues.
And I think for me, that's my biggest concern and my biggest worry. And in fact, the board gave Edith and I a target to reduce our deficits over a 3-year period to get to break even. We managed to do it in 2 years. But I've been quite honest with my chair and my trustees and said we should never celebrate a reducing deficit budget. Because I think the reality is lots of people, other than Edith and potentially myself, don't realise that we've got through that deficit year by just, again, eating into our reserves. So I really feel it's a burning platform at the moment. And just to give you some substance with the trading company, so right now, this year, because this is a difficult year for us, we are packaging up things that we do exceptionally well. I'm talking about building my reserves. But how do I build my reserves when I can't generate a profit with my core business? It's incredibly challenging. I'm never going to be able to build up my reserves from income generation because we're struggling to hit any target that we need to deliver on our core services.
Right.
However, I'm just giving you a little flavour. It might not sound like much. We provide therapy, that's physical therapy, and we provide psychological therapy. And we will provide that for as long as people need it out in the community. But what we are currently packaging up is a bronze, silver, and gold private practice palliative care. Never been done before, but why shouldn't we? Every other healthcare provider would do that. And the other thing, just to recall, is we have to collaborate with people who can help us. And so we're looking at collaborating with retirement homes, retirement villages. They want packages of something or other as an and bonus for these really expensive living accommodations. Yeah. So we're looking at partnershiping with a very premier company to see how we can be part of the add-on package to them. So we're exploring everything at the moment, because unless I do that, I don't know how I'm going to build my reserves. Sorry to be practical with a financial field in front of me.
The last question, I believe, is from Lisa. So she says, we are a hospice with a deficit for this coming year. We're in the process of starting a zero-based budget for 2026-29 to try to reduce this deficit down to break even over 3 years. What tips do you have to get budget holders on board with this and thinking about not just the big things, but also the small changes?
I think it's as I said, the Every Penny Matters campaign, and data. So I had a lot of long faces. So I don't know who you are, but there will be you will have a community service, call it a hospice at home service. And I saw them all here in the morning, and I saw them all here at lunchtime, and they all had a really nice meet up before they went home at the end of the day. And yet the work they provide is in the community. So once we actually started looking at their contact time and looking at their productivity, then how much of their day, 29% of their day was spent traveling or in a meeting or congregating here. As soon as we gave them our phones and iPads and said, you don't need to come into the hospice. As soon as we started to plan their routes and their care for the next day with as minimal travel time as possible, your productivity rockets. Now, when you first produce that with them, we all know where we want to go, but that's why we had the Every Penny Matters. Every contact counts. That's right. Is we then made them part of the solution. We knew where we wanted them to go, but we said, look at the facts. This isn't what you're here for. You're here to care. How do we release time to care? What is it you need? And that's when we bought the computers, the iPhones. That's right. So my advice is to show them the data. And if you can translate it all the time back to the person, the patient, because that's the one thing that we are all united with here. If we're wasting £2,000, those £2,000 could be better spent on a person. But I'm happy to talk to you offline and to share anything with you. But good luck with that. I think what you're doing is exactly the right thing.
And again, just to add to that, we also look at the establishment. Yeah. What establishment is required to run a particular department? What establishment do you need to run, say, the finance department, the HR, the IPU, the hospice at home, fundraising? And so we were able to say, yes, look at the establishment. Do you need all of these 30 people? What hours? What jobs? And we looked at all of those things, and we were able to strip down from those to make sure that we're not just carrying people for carrying sake when if you don't need them. So you have to look at the establishment that is required as well, and the hours that is required, because like Lisa said, there's impact analysis. And so looking at what you're doing, what are you delivering? What is the impact? How can we measure it and stuff like that? So we've gone through all of those to make sure that everything that we say we're doing adds value and is value for money as well. So those are the things that we've actually done. So, and we'll continue to do because we have to survive.
Something to look out for if you are in the hospice or clinical is shroud waving.
Mm-hmm.
Okay, I can't take those costs down because it will impact on quality.
That's right.
It's really important that you don't just listen to that and really understand that. But one of the things, and that's the culture biting, they will put quality in front of, but actually, if you do a quality or equality impact assessment before you take the cost down or improve the productivity, then you can assure yourself or the board or your founders that what you are doing is actually going to have a better impact on quality because you're going to treat more people or you're going to be able to reach more people for the same level of costs. But as I say, we're very happy to share anything with you.
And I think those are all the questions. So I will just move on. So this is how you can stay in touch with me. Ignore the health sector bit there. It is the public sector group. So if you can please join the public sector LinkedIn group so we can stay connected. And this is my personal LinkedIn, and then that's my email address. And then for Edith and Lisa, these are their contact details. So if you have any questions or you need anything, please drop them an email, and I'm sure they'll be happy to assist you.
Yeah, just to add to that, Petra, we have the public sector LinkedIn group. We also have the WhatsApp group for the public sector as well.
Yes,
so
yes, we do.
Please join either ones. Yeah.
Thank you. Should they email you to join that the WhatsApp group?
Yes, I mean you can see us there. Yeah, I'm one of the admins. So
okay, fabulous.
If you text me and then I can add you to the WhatsApp group.
Okay, so
because we do share ideas and stuff in there as well.
So if you can get in contact with Edith and she will liaise with you to join the WhatsApp group. But I hope you all enjoyed today's session, and I